From KAMR Local 4 News, your local election headquarters, this is Politics Today.
As the government shutdown continues, how it's impacting a big industry on the High Plains and a resource available for those impacted. A solar facility project in the works for a part of Potter County, but some residents say not so fast. We'll detail why. As the government shutdown continues, we're learning how it's impacting us locally. Thanks for joining us this morning. I'm Jack Kessler. Politics Today's Blas Guerrero explains how it's impacting the ag industry and some help available.
The government shutdown is having an impact in the High Plains, with farmers and ranchers losing access to critical support programs that many rely on.
From a day-to-day perspective, there's a lot of activity going on and probably wouldn't think it would even matter. Reality is it has a great impact. Agriculture has been in challenging times. All of the loan efforts from USDA, FSA are going to be curtailed. And one of the critical problems with agriculture right now is a credit crisis. We go to the bank and banks are going to be struggling to keep us financed.
Blankenship says the shutdown adds to years of challenges, including drought, low crop prices, and high input costs.
Short term, it's just a further delay. It's one more day that we're pushing something, kicking the can down the road on passing a farm bill. It's one more delay in implementing of policy that's already been passed. From a long-term perspective, it probably means bankruptcy for operations.
Beyond farmers, federal employees in the area are also hurt from the shutdown, and Catholic Charities is stepping up to help.
And with the government shutdown, we understand that employees may need to have some extra support they've never really needed in the past, and so we're opening our doors to anyone who was a government employee that is temporarily laid off, that we will give them food. They can either come in and shop, or we can give them a pre-boxed box of food.
The organization says they'll keep helping for as long as the shutdown lasts. As for farmers, they'll keep doing their work even without the federal support they depend on.
Blankenship warns that if the shutdown continues in the long term, the New World screwworm could devastate livestock with no federal monitoring in place. As of now, according to the Department of Ag, that and other critical services will continue. Even as of Thursday, the FDA conditionally approved a cattle-only injection meant to prevent the New World screwworm infestation. If federal workers need help from Catholic Charities, they can bring a government ID and proof of furlough for food boxes or pantry shopping. Speaking of the ag industry, a proposed bill could give cotton farmers insurance coverage if their crop production is impacted. Congressman Ronnie Jackson announced a Agriculture Infrastructure Stability Act. He writes that if passed, cotton farmers could have crop insurance to help them manage increased risk if their crops fell early in the growing season. Congressman says that this will help ensure enough supply. Officials say that this protects the producer and the cotton gins with stability. A proposed solar farm in Potter County is raising concerns among residents who say that they felt left out of the process. Blas Guerrero has more details on the project and the pushback from residents.
Xcel Energy and Southwestern Public Service are looking at building a solar farm in the Rolling Hills area north of Amarillo. The project would cover about 1,300 acres of land currently zoned for agriculture.
So right now, everything is still just in the beginning of stages. Xcel and SPS has recently sent out letters to some residents in the area of Rolling Hills, and that's when I got contacted earlier this week, was by some concerned citizens. And we just now started looking into it.
Commissioner Schaefer says one possible benefit could be an increase in the county's tax base, which could help the county and River Road ISD. For residents, the concerns are piling up.
I received a letter in the mail from Xcel stating that they are going to turn the land surrounding our home into a solar farm. After reaching out to neighbors, I have found out that nobody else has received this package or information except for about 4 or 5 people out here.
Residents in the area say they worry about falling property values, environmental impacts, and how the solar project might change the views surrounding their homes.
This, to me, is not a debate on whether or not we like solar power or wind power or anything else. I do have a problem with is when you drop it in the middle of hundreds of homes, an elementary school right there, and just going to do that, and all our property values go down. When there's so much land available on the Texas Panhandle and New Mexico that's out in the middle of nowhere.
County leaders have scheduled a community meeting for Tuesday at 6 p.m. at Pleasant Valley Methodist Church, where residents can ask questions and hear directly from Xcel officials.
Now, if approved, the proposed solar farm would be located north of Loop 335 and south of Cherry Avenue between Western Street and Broadway. Officials emphasize that the county commissioners do not have the power to approve or deny the project. Residents have started a petition and have until November 10th to file comments or request to intervene at the Public Utility Commission interchange website. We reached out to Xcel, who confirmed this was a proposed plan but did not comment further. For more details on the proposal and the meeting details, you can visit our website, myhighplains.com. The U.S. Department of Ag announcing that they will discontinue the Household Food Security Survey. That's a key component in data collection for places like the High Plains Food Bank. Executive Director Zach Wilson says they and others in the network are looking for ways to conduct the survey moving forward. USDA called the reports costly, redundant, and politicized. Wilson says they do send out their own surveys from time to time.
And of course, here in the High Plains over the past couple of years, it's been driven by disaster. Wildfires, floods, tornadoes. We've seen that over the past 2 years. So something that a potential national survey couldn't capture, because things change so rapidly here on the High Plains. So
that they get information from partner agencies about who needs help, how they need help, and what reasons people give them when they receive help. He says that they may increase how many food studies they conduct throughout their food bank network. The blame game is alive and well when it comes to the government shutdown. More from Texas Senator John Cornyn on where lawmakers go from here. And as we reach peak sick season, a local doctor is talking to us about vaccines and ways to stay healthy. The government continues to be shut down. That means funds have lapsed. Some workers are furloughed, others are working without pay. What's holding up lawmakers are subsidies for the Affordable Care Act that would cause premiums to double or even more in a few months. That impacts millions of people. Our DC Bureau caught up with Senator John Cornyn for his reactions.
I think the Vice President said it yesterday. He said, open the government back up and then we'll talk, which is, I think, a rational, reasonable position to take. But so far, as you point out, Democrats seem to be pretty dug in. I think they've gotten themselves in a box canyon and they are having a hard time figuring out how to get out of it.
And some Democrats have said that, you in March passed this CR and then with 60 votes and then came back and the threshold for rescissions was 50. Would you be open to changing that?
No, I think once we reopen the government, I'm open to any discussion. But what they're demanding is completely outrageous. It's trillions of dollars and more spending. It's repeal some of the provisions of the One Big Beautiful Bill, now called the Working Family Tax Cut Act, that would deny taxpayer-supported health care to illegal aliens. And there's a $50 billion rural hospital stabilization fund that they want to repeal and spend on other purposes. Texas is a big place. We have a lot of rural hospitals that need our help, and I'm not going to vote to repeal that provision.
So, and then would you be open to something like changing the filibuster if Democrats aren't willing to get on board for this CR?
I don't think we should blow up the Senate in the way it operates in order to appease this obstruction by Democrats. I think time will gradually convince them that this is a losing game on their part, and they'll come around. But in the meantime, they are also risking a lot because the director of the Office of Management and Budget is talking about making some major cuts and federal government employees during this period of time, which he has broad discretion to do. So they're really playing with dynamite.
Yeah, are you okay with the president and OMB director with these massive layoffs if the government stays closed?
Well, I don't know how massive they would be, but it's interesting when the government shutdown occurs like this, then usually there's essential government employees, and then there is the non-essential. And it makes you wonder whether, if people are non-essential government employees, why are they working for the government? Why are we spending money we don't have and borrowing from future generations to pay for that? So I think maybe it'll provoke a discussion about what is the right size of government staffing. But that's just another maybe unintended and for Democrats maybe unwelcome consequence of their boneheaded idea to shut down the government.
And then the OMB director also posted these, he called them Green New Scam grants that will be cut to 14 states, I believe it is, and they were all states that had 2 Democrats in the Senate.
Yeah.
Are you okay with him targeting those specific states?
Well, I think, when you get into a conflict like this, people are going to do things that they wouldn't otherwise do. We do need to have serious conversations, and we've dealt with some of these Green New Deal scams, as you call them, and maybe as he called them, and some of them make no sense whatsoever. And when we're $37 trillion in debt, we need to find ways to cut federal spending, and certainly waste, fraud, and abuse, and that may be one of them.
And do you think you're making good progress on an actual budget? Aside from the CR?
Well, the Appropriations Committee is talking about needing this additional time in order to work on bipartisan and appropriations bills with the House of Representatives, which I think is a worthy objective, a worthy goal, because that will get us away from all the drama of these periodic shutdowns and by doing a regular appropriation. So that's why we need the additional time to November the 20th so that can conclude hopefully successfully.
And then how long do you think it'll take to get these 5 more Democrats on board that you're looking for?
Well, it's really their call, but I can tell from my conversations on the Senate floor yesterday that there are a lot of nervous Democrats because they're having a hard time explaining this shutdown back home, when historically they have always decried and criticized government shutdowns. I think the Democratic leader called it idiocy, and now here he goes engaging in what the kind of conduct he himself has labeled as idiocy. So I agree, it makes no sense. Nobody wins in shutdowns, and it's just, I think, unfortunately conveys a sense of dysfunction and undermines confidence in our ability to do the work on behalf of 320 million people.
And part of the reason the GOP is refusing to extend the subsidies for the ACA is because they claim that health care is being given to immigrants in the U.S. illegally, but that is illegal. Emergency rooms are legally obligated to treat any patient regardless of immigration status, and that money is reimbursed by the federal government, but that law has been in place for decades and benefits perhaps those in the country illegally, but also those without insurance or low-income households. The fall and winter are the sick season for many, but as we get closer to the flu season starting, we'll hear from a local doctor about the vaccine schedule and his advice. Fall season means sickness. We've got allergies, the cold, the flu, and COVID-19. So who should consider getting one or all the vaccines available for the season? We sit down with Dr. Rodney Young for some answers.
This time of year hits and the air goes from relatively warm, and in this area relatively warm and dry, to relatively cold and dry, or when it fluctuates between warm and colder, sometimes pretty rapidly in the panhandle, that can wreak havoc on respiratory passages for a number of reasons. The first is just that some people have fall allergies, so they'll have symptoms related to that are a little more prevalent. But also commonly in the fall each year, things happen where, kids head back to school. We all head indoors more because of avoiding cold weather, and you get colder, drier air. And in colder, drier air, many of the viruses that cause respiratory illnesses, commonly like cold and flu, for example, they thrive. The viruses are actually more durable, more stable, and they'll hang in the air longer, so it's easier to transmit them from person to person. And then we put ourselves into crowded circumstances where we're close to each other more commonly, so that it's easy to pass viruses from person to person. We do that more effectively during the fall and winter months.
And you kind of already touched on it, but school could be kind of a nasty place with a bunch of germs. Tell me how people could stay protected while they head back to school.
Well, school's one of those things that's, it's great for our society, but it's a little bit of a necessary evil in terms of like spreading viruses and things around. So kids are going to go, they're going to be in relatively close contact, particularly younger kids. They're not accustomed to trying to do things like cover coughs and things like that. But probably rule number one is that if your child is sick or appearing like they may be sick, trying to keep them home is one way to help diminish spread in there. So that sometimes that's easier said than done. But watching for things like them just not feeling well, getting the sniffles, runny nose, watery eyes, those are signs that potentially they're shedding virus that could be very easily transmitted person to person and home to home. Those kids then take those illnesses home to their family members, and through household contact, the rest of us sort of become sick in the process too. So keeping home, and that applies for adults and kids alike. So if you have symptoms like that, trying to stay home could be helpful. Nobody loves them, but the masks that we use during the pandemic, if you need to be away from the home and you have respiratory symptoms, those can be helpful in trying to diminish transmission. They don't make you bulletproof. It's not perfect, but they do cut down quite a bit on your ability to cough or sneeze, project that across the room, have it hang in the air or land on the doorknob, place things that people touch, and then subsequently transmit from one person to another. So trying to do those things, maintaining space, if you need to be in an area where other people are, but you're not feeling great, and, it's a time to be considerate about personal space. Try not to, hang too close and be close to others. And then washing your hands frequently. We can't really emphasize this enough, particularly before, you're going to do anything like brush your teeth or, put on makeup or anything like that. But also just washing your hands frequently to diminish the likelihood that you might have touched something that was lingering on a surface or in the air, and then you rub your eyes or your nose and you inoculate yourself, allow yourself to get sick. So frequent hand washing, trying to isolate or keep space, sometimes wearing masks, and then just staying home if you feel unwell. Those are all measures that can make a lot of difference in the respiratory virus season.
Dr. Young says the American Academy of Family Physicians and the American Academy of Pediatrics have not changed their recommendations for vaccines, so he encourages everyone to talk with their physician to see the best fit for them. He served the city of Amarillo for a few decades, and now he's being recognized for all the work and effort he's given to the city. Details on the award given to this city employee. That's next. City of Amarillo Special Advisor Floyd Hartman has been recognized for his work and commitment to the development of the city. Hartman has earned the B. Lee Goodwin Public Administrator Award. He's presented the prestigious award during the 2025 Panhandle Regional Planning Commission annual meeting. This award represents Hartman's service and hard work as a public servant for the last 30 years.
It's quite humbling and honoring to get an award, especially when it comes from a recommendation and your peers. That is really humbling and honoring to be recognized with the group of people who have received it in the past.
Hartman has worked for the city of Amarillo in a variety of capacities for the last 20 years. He has announced he will be retiring in January. Come November, your ballot during that election will be a long one. We've got several constitutional amendments to decide on. The League of Women Voters say that they have been getting phone calls about their voter guide. Each election cycle, the nonpartisan group puts out information on each candidate or issue on the ballot. They'll have their constitutional amendment election voters guide available now. You can access that by going to lwvtexas.org or vote411.org. We're sinking into our final stories on politics today after the break. Keep it here. TxDOT crews will continue to fill and repair a sinkhole in Cottle County. Let's talk about what happened this week. So this is on FM 1038 southeast of Paducah. TxDOT crews will continue to fill that sinkhole. It's a 40 by 40 by 70 foot sinkhole. Officials say that they will continue to haul material to the site and get the equipment needed to work that to start that work, they expect to begin filling the hole midweek of next week. No word on when that work will be completed. They encourage people to obey the road closed signs and barricades in that area. You can stay up to the latest political news with us this week. We have continuing coverage on our website, myhighplains.com. I'm Jack Kessler. This is Politics Today.